Thank you for joining the Exercise for Healthy Bones talk, provided by the Integrated Falls and Bone Health Service in Wandsworth. You have been invited to participate in this activity as you have a diagnosis of osteoporosis or osteopenia, or you are at risk of developing these conditions. Before we begin, please take a moment to grab a pen and paper, as I will ask you to write down a few things as we progress. You might also learn some new information that you wish to jot down. I'd like you to take a moment to think about what you know about bone health. Now rate this on a 3-point scale, selecting one option from I know nothing about bone health, I know something about bone health, I know enough about bone health. Write down your rating. Now think about how confident you feel managing your bone health. How do you rate your confidence on a 3-point scale, selecting one option from not at all confident, fairly confident, very confident? And again, write down your rating. We will come back to review these at the end of the talk. The 3 main aims of this talk are to provide you with information about osteoporosis and what is in your power to manage osteoporosis, to discuss reasons to think about making changes to improve your bone health, and to provide other resources and opportunities to help with possible changes. What are osteoporosis and osteopenia? In 2015, it was estimated 3.5 million people had osteoporosis. The prevalence of osteoporosis increases with age, from 2% at 50 years to over 25% at 80 years in women. It can be helpful to think of a continuum of bone density: healthy bone at one end, osteoporosis at the other, and osteopenia in the middle. The image on your left represents healthy bone. Healthy bone has a honeycomb structure with holes and struts. Compare this to osteoporotic bone on the right: bigger holes and thinner struts. A helpful analogy can be to think of bone like a knitted jumper. Healthy bone is tightly knitted, whereas osteoporotic bone is more loosely knit. Or think about a chocolate bar. Healthy bone is like a crunchy bar, whereas osteoporotic bone is more like an aero bar: bigger holes, thinner struts, and easier to break. When we think about bone, many people think of them as a solid, chalky structure. Bones are actually living tissues that are constantly redeveloping and remodelling themselves. So much so that the skeleton you are sitting in today is not the skeleton you'll have been sat in 2 years ago. Remodelling allows bones to stay strong to withstand physical activity. They are strengthened by calcium phosphate, have their own blood supply, and are adaptive and respond to any changes in activity. Bones are made up of 2 types of bone: a harder, heavier structure called compact bone, which makes up 80% of the human skeleton, and that can be seen around the edge of the bone here. And a spongier, lighter bone called trabecular or spongy bone. Overall, our bones are lightweight structures to allow us to move efficiently. If you had a bone, cut it in half and look down on the cross-section, you would see that the spongy bone has a mesh-like structure, a bit like honeycomb. Our lifestyle, including our level of activity, smoking and drinking, as well as genetic factors, can alter our bone's ability to adapt when needed. Our bones constitute our skeleton, which allow us to move, keep us upright, and protect our vital organs. There are 2 types of cell involved in maintaining your bone health: osteoblasts and osteoclasts. Osteoclasts are responsible for clearing away old bone by reabsorption. Osteoblasts are responsible for forming and laying down new bone. The way that the two types of cell interact is called bone turnover, and this process is hormonally regulated by estrogen in women and testosterone in men. In general, the processes of bone reabsorption and formation are coupled so that there is no net change in bone density. This only differs in children, where the amount of new bone formed outweighs old bone reabsorbed, and in older age, where less new bone is formed. As you can see from the graph, our bones are strongest in our early 20s, which is when we reach our peak bone mass. This means that adolescence is a critical period to build new bone. If we don't do the right sort of activity and maintain a good diet in our adolescence, we have less bone mass in reserve for later in life. After reaching our peak bone density in our 20s, our bone density plateaus in our 30s. After 40 years of age, the reabsorption process increases, meaning our bones become less dense, which is a normal part of aging. We lose about 1% of bone per year. When women hit the menopause, the reduction in estrogen means that more bone is reabsorbed than formed, which results in a significant reduction in bone density. For men, testosterone levels remain fairly similar throughout life, so they don't experience the significant decline in bone mineral density that women do. Osteoporosis can still occur in men though, and we will learn about some of the mechanisms later in the talk. The key thing to take away from this is that the amount of bone loss that leads to osteoporosis is not a normal part of aging. It can be prevented. Some people are more at risk than others. It's a bit like heart disease. The risk increases with age, but not everybody gets it. Maximising bone density at an early age is key to preventing fragility fractures in later life. So get your children, grandchildren, and great-great-grandchildren active. There are different risk factors for osteoporosis and osteopenia. Some are lifestyle factors that we can change, but some are related to medications, medical conditions, and genetics. Write down any risk factors for osteoporosis you can think of. And underline which of these risk factors apply to you. You may wish to pause the video to complete the activity. The first 5 risk factors are, for the most part, out of your control. As already discussed, age and sex are key risk factors for osteoporosis. The prevalence of osteoporosis increases with age, from 2% at 50 years to over 25% at 80 years in women, reflecting the marked increase in rate of bone loss once estrogen's protective effect is lost post-menopause. Family history is a risk factor, as osteoporosis does run in families. There are inherited risk factors that affect bone development. Genetic factors affect achievement of peak bone mineral density. Therefore, if a close relative has osteoporosis, then your own risk is likely to be greater than normal. The risk is greater if a close relative suffered a fracture linked to osteoporosis, often called a fragility fracture. Certain medical conditions increase your risk of osteoporosis in a variety of ways. Examples include rheumatoid arthritis, hypothyroidism, parathyroid disease, low levels of sex hormones in men as a result of surgery for some cancers, Klinefelter or Kalman syndromes, low levels of sex hormones in women as a result of early menopause, hysterectomy with removal of ovaries before the age of 45, conditions that affect the absorption of food, such as Crohn's disease or celiac disease, and conditions that cause long periods of immobility, such as stroke. Certain medications are known to affect bone strength. Steroid tablets, also known as glucocorticoids, if taken for more than 3 months. Anti-epileptic medications. Breast cancer treatments, such as aromatase inhibitors. Prostate cancer treatments that affect either the production of testosterone or the way that testosterone works in the body. The last 5 risk factors are the ones you have the power to change. If you have low body weight, you are likely to have less bone tissue. You are also likely to have less padding around the hips to cushion the impact of a fall. Smoking slows down the cells that build bone in your body, the osteoblasts. Smoking also increases the risk of an earlier menopause. Postmenopausal women are at a greater risk of osteoporosis and breaking a bone. Alcohol affects your bone turnover and makes you unsteady on your feet, meaning you are more likely to fall or trip and break a bone. Inactivity and immobility can result in bone loss. Space travel has provided fascinating data on weightlessness and bone loss. Astronauts exposed to the microgravity of space experience significant bone loss, which leaves their bones weak and less able to support the body's weight and movement upon return to Earth. In the same way, people who cannot or do not participate in the right kind of physical activity often experience a significant bone loss and are at high risk for developing osteoporosis and fracturing a bone. Calcium and vitamin D are vital for maintaining healthy bones. Our bones hold 99% of the body's calcium. The only way we get calcium is in our diet. Vitamin D helps the intestines to absorb calcium and the bones to mineralise, i.e. to fill with calcium, which gives bones their strength. Bone mineral density measures bone strength as represented by calcium content. So how many of those risk factors did you get during that activity? And having heard all that information now, which ones do you believe apply to you? A fracture that is the result of a fall from standing height is defined as a fragility fracture, and this is indicative of osteoporosis. The most frequent fracture sites linked with osteoporosis are the wrist, the hip, and the spine. This is because these areas are made up of more trabecular or spongy bone, which is softer and meshier. The vast majority of fractures are due to a fall. One of the key parts of osteoporosis self-management is prevention, and there is a lot you can do. Wrist fractures occur in the younger population, typically women in their 40s or 50s and men in their 60s. They're not always disabling, although they can be, especially for someone living alone. Often this is the first signal that an individual may have osteoporosis. Hip fractures commonly affect older people and severely reduce quality of life. They can lead to a long hospital stay, leaving many people less mobile and less independent and needing more help. Vertebral compression fractures occur when bones become squashed down or wedge-shaped. Although these fractures heal, they do not return to their original shape. They differ from other fragility fractures in that they are not usually a consequence of a fall and may occur following routine daily activities such as bending or lifting. A vertebra in the spine has several parts: the spinous process, the transverse process, and the vertebral body. A healthy vertebral body is equal in depth throughout the spine. When a fracture occurs, it is the vertebral body at the front of the spine, as indicated by the red markings representing a fracture, This type of fracture is often called a wedge fracture. As you can see from the outline drawn around each vertebral body, it becomes wedge-shaped compared with a healthy vertebral body above, hence the name. These types of fractures are also called compression fractures or insufficiency fractures. They all mean the same thing. Vertebral fractures heal in 6 to 8 weeks, but don't regain their shape. How do you know if you have suffered a vertebral fracture? Pain is one indicator. Wedge fractures can be acutely painful, but generally improve as they heal. It is likely to be a sudden onset pain associated with a movement. However, many people do not know they have sustained a wedge fracture. Often it is identified incidentally when receiving an X-ray or scan for an unrelated condition. As such, acute onset of pain is not certain to be a fracture, and you should contact your GP if you have any concerns, who will be able to order an X-ray if required. Wedge fractures can lead to kyphosis, which is a forward curve or rounding of the spine. As shown in the image on the left, this is a healthy posture and a healthy spine, and this shows a kyphotic posture with the excessive curvature of the spine in the upper back here. Some people refer to this as a dowager's hump, although this is not a term healthcare professionals use. The change in the way the spine is shaped and the way it functions in relation to the other vertebrae means there is a greater risk of another fracture, but there is a lot you can do to help yourself when you feel ready to do so. So what can you do to protect your back? First of all, keep active. Bones really love the right kind of activity. Move with awareness, for example, hinging at the hip to bend and lift. Keep your back straight or neutral when bending and lifting, and be sure to bend at the knees and hips instead of the back. We will look at some images of how to do this a bit later in the video. Also, please take advice from your physiotherapist about reducing your vertebral fracture risk and exercise. A little quiz time now. What can you do to help your bones? Write down as many things as you can think of that you can do yourself to keep your bones healthy. Please feel free to pause the video to take part in this activity. So how many different things did you come up with that you can do to keep your bones healthy? The good news is there are lots of different things you can do to help yourself maintain healthy bones, most of which can be grouped under these 5 headings. Taking medication, activity or exercise, moving with awareness, getting sufficient calcium and vitamin D, and reducing your falls risk. The most common treatments prescribed for osteoporosis are bisphosphonates, for example, alendronic acid, which is an oral once-a-week tablet. Be sure to read the information leaflet about how to take it to ensure you get the full benefit. Other treatments that are given by injection or infusion into a vein are denosumab and zoledronate, respectively. If you have any questions about your medications, please do consider contacting your GP. Some people are prescribed calcium and vitamin D, sometimes known as calcium carbonate and cholecalciferol, or Adcal D3. There are other brand names too. Some GPs recommend that you buy calcium and vitamin D at the pharmacy. Calcium is vital for strong teeth and bones because it gives them strength and rigidity. Most people should be able to get enough calcium through healthy eating without the need for additional supplements. The recommended amount of calcium per day is 700 milligrams for an average adult and 1,000 milligrams for people taking drug treatment for osteoporosis. You might also benefit from up to 1,000 milligrams of calcium per day if you have osteopenia. If you cannot get enough calcium in your diet, then a supplement might be recommended by your GP or physiotherapist. The government guidelines for vitamin D are 400 international units per day, which is the equivalent to 10 micrograms per day. Public health advice is to take this supplement during the winter months of October to March. However, during the pandemic, UK government advice is to take this throughout the year, as we might not be getting sufficient sun exposure due to lockdown. When the sun's rays fall on your body, they react with your skin to make vitamin D. In the UK, your skin can only get vitamin D from sunlight between March and September. During this time, it's recommended you expose your skin to direct sunlight for around 10 minutes, once or twice per day. Give your skin short periods in the sun when you haven't applied sunscreen, while you're doing short outdoor tasks like hanging out the washing, pulling up the weeds, walking to the shops. Exposure of forearms and face is enough. You don't need to be in your swimming trunks or costume. Do remember, if the weather is cloudy, it takes longer to produce the same amount of vitamin D as on a sunny day. Glass blocks the sun's rays, so go outside or open your window. Darker skin produces vitamin D at a slower rate, so you might need more time in the sun. Sunblock and high-factor sunscreen stops the sun's rays reaching your skin and reduces the amount of vitamin D your body makes. If your skin is exposed to the sun for more than 10 minutes, always use sunblock or sunscreen. And avoid exposing your skin to direct sunlight in the middle of the day when the sun is at its strongest. Don't be tempted to not wear sunscreen for long periods to increase your vitamin D levels. You may do more damage to your skin than good for your bones. The Royal Osteoporosis Society developed some guidelines with prominent clinicians and researchers in the osteoporosis field called Strong, Straight and Steady. This covers the key self-management principles about exercise and activity, moving with awareness, and falls prevention. One of the key things to remember is that activity and exercise are really good for bones, so be confident in your ability to start doing a bit more activity. Follow the advice we provide here to ensure you are doing it in the best way for your bones, and adapt any exercise you are currently doing to improve the positive effect on your bones. Key to reducing the risk of vertebral fracture is postural awareness, moving with awareness, and back muscle strengthening. The lifting image on the left shows you the best way to keep your back safe. Feet apart, back straight, bend at the waist and bend your knees. Keep heavy loads close to your body to reduce the stress on your spine and in particular the vertebral bodies. To carry shopping, 2 equally weighted bags, 1 in each hand, or a backpack, maintaining that good posture. And when washing up, as shown in the picture at the bottom, keep your back straight. You can try opening the cupboard beneath the sink and using this as a footrest to help maintain good posture. Posture and good form is very important when doing exercises, so you should always get advice or opinion of an exercise professional. As it is the front part of the vertebrae that are more likely to fracture, posture is really important in reducing the risk. Adopting a forward bent posture throughout our busy lives and certain daily activities in a bent forward or twisted manner can increase the risk of a fracture. So good posture and good manual handling technique are very important for maintaining your bone health. Can you think of other daily activities that might need to be adapted to look after your bone health? For example, vacuuming or mopping. Take a moment to think about how these activities might be adapted to move with awareness and care for your spine. Please feel free to pause the video to participate in the activity. Let's briefly review that activity. For mopping and vacuuming, take a wide tandem stance, which is 1 foot in front of the other. Vacuum right in front of your body and stand up nice and straight. Move by shifting your weight side to side through your legs and keep your elbows close to your body. The same suggestions apply to mopping the floor. Only fill the bucket halfway so it's not too heavy to lift, and apply those lifting principles we've already learned. If you find yourself cleaning using a bucket or bowl of water, have your bucket on a higher surface rather than on the floor. If you're unloading the washing machine, squat down in front of the washing machine, keeping your back straight, or hinge at the hips if you are unable to squat. So working on your leg and bottom muscle strength will really help you better complete daily tasks like these with improved technique. So gluteal or bottom muscle strength is really important for your back. Research has shown some really interesting facts about bones. A professional tennis player will have 25% greater bone density in the serving arm compared to the non-serving arm to compensate for the greater forces going through that arm. However, if we stay in bed, by day 3 there is evidence that the bones are starting to be affected, as calcium can be detected in the urine. Bone loss occurs at 1 to 2% per month with prolonged bed rest. The correct exercise can increase bone density by 1 to 3%. This is a great way to counteract further bone loss that will naturally happen to everyone as we age, but in particular those at risk or with a diagnosis of osteoporosis. After menopause, a woman will reduce her bone mineral density by 2 to 3% per year, and a man by 1 to 2% per year. To affect this bone laying down process, the bone cells need to detect high levels of stress and strain. This means bones need to be compressed and pulled to stimulate bone cells to lay down more bone. To compress bone, we need weight-bearing exercises, which simply means bearing the weight of your body through your limbs. The greater the load, the greater the stimulation of the bone. For hips and spine, walking is great. But if you've always been a walker, then walking faster and uphill will begin to stimulate the bone. Doing this while holding a load, hand weights or a backpack for example, even more so. For the wrists and shoulders, lean on your hands. Wall or floor push-ups, pushing a supermarket trolley or buggy, or any exercise on all fours. The guidelines recommend 50 moderate impacts daily. That means stamping, low jumps, hopping, or 20 minutes lower impact, for example, walking up or down the stairs. People who have vertebral fractures and are new to exercise should make sure they pace their exercises and gradually build up the amount that they are doing. Your physiotherapist will have prescribed exercises for you that are appropriate for your spine, taking into account your fracture risk. Government aerobic exercise guidelines for adults recommend 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise every week, which goes hand in hand with the 50 impact guidance from the Royal Osteoporosis Society. To stimulate the bone by pulling, you need resistance exercises. Muscles attach to bones. When muscles contract or tighten, this pulls on the bone where it attaches. The greater the load, the greater the effect on the bone, which can be achieved by using exercise bands or weights. Therefore, heavier weight or tougher exercise bands means higher load. Aim to lift heavier weights, but complete fewer repetitions of the exercise. It will have greater effect on your bone than a lower or easier weight and more repetitions. For each exercise you choose, aim to lift a weight 8 to 12 times at most with good posture. Decrease the load if it is too challenging and increase if easy. If 12 repetitions is easy, you need to lift a heavier weight. The weight or load and number of repetitions will be different for everyone. Aim to make the exercises more challenging as you build strength. You can increase the weight or try a different position. This is better for bone strength, as the best exercise for bones needs to be novel and challenging. As you get stronger and fitter, you will need to lift heavier weights or increase the speed at which you are walking, for example. Aim to make the exercises site-specific. For example, exercise at the hip only affects the bone at the hip, so you need to cover different sites, in particular the hip, wrist and spine, as these are the most common fracture sites. Pacing is important, which means taking time to do the exercises properly and resting between sets, as this will also help to avoid injury. Back extensor muscle strengthening is very important for posture and for reducing vertebral fracture risk. The muscles in your back that lift you against gravity and keep you upright are your back extensor muscles. For posture, you also want to work on endurance. Have you ever noticed that your posture was a bit slumped, so you straighten up only to find yourself back in that slumped position again shortly afterwards? That is down to endurance, the ability of the muscles to work and keep working for long periods of time. As such, when you exercise, you want to work on this too. Try a 3 to 5 second hold up to 10 repetitions when exercising lying on your stomach, lifting your chest and head off the floor as shown in the image. To sum up this section on strong, as part of the strong, steady and straight guidelines, try building up to completing bone-loaded exercises on 2 to 3 days each week, in line with government guidance and guidance from the Royal Osteoporosis Society. The steady part of the guidelines focuses on falls prevention, which is preferable to rehabilitating after a fall. To improve balance, you need to challenge balance. This reduces falls risk and therefore fracture risk. If balance is not a problem for you, then it is important to maintain the balance that you have. Try different balance exercises and you'll find something that challenges you. Balance exercise is easy to fit into daily life. At the kitchen sink, waiting for the kettle to boil, while you're brushing your teeth, or at the bus stop. Stand on one leg and time how long you can do this for before you need to stand back on 2 legs. Keep trying to beat your time. This is also a great way to monitor your improvements. At home, try standing with your feet together and your eyes closed whilst holding onto a stable surface for safety. Dance and Tai Chi are other ways you can work on your balance. Remember that exercises for increasing strength will also help balance. The recommendations are to complete balance work 2 to 3 days per week, or if you are having falls, then every day. The recommendations for working on balance to reduce falls risk brings us nicely onto this final section, which is a brief discussion about other falls risks and how you can reduce them. We've already talked about strength and balance in the last section, so let's move on to coordination and flexibility. Coordination is the ability to move different parts of your body together in a smooth and effective way. It is related to reaction time and coordinating your body's response to an unexpected challenge to balance. Flexibility refers to the ability to move your joints through their full movement without restriction or pain. We become less flexible as we age because there is less fluid that usually lubricates our joints. We sometimes become less active, or we experience pain, which in turn affects our flexibility. Flexibility is important to reduce the risk of injury and help coordinate an effective response when our balance is challenged. Incorporating flexibility and coordination exercise into your routine can help to reduce your risk of falling, which in turn reduces your risk of a fragility fracture. Our senses are vital in maintaining our balance, so optimizing your hearing and vision are really important. It can be difficult to orient yourself in space when you cannot hear properly. Equally, if your prescription glasses are out of date or your vision has deteriorated, this can negatively affect your balance. So consider booking yourself a sight test and getting your hearing checked regularly. If you have difficulty getting to the toilet on time, you might find yourself rushing. If you need to use the toilet overnight, this can increase your risk of falling if you do not turn on the light. If your blood pressure drops when you stand up quickly from a lying position, which can make you feel lightheaded, or if you are disorientated when you get up. Speak to your GP if you have problems with continence. If you have foot problems, including pain or reduced sensation, it can be difficult to walk in the normal way. Foot problems can occur for a variety of reasons, including bunions, hard skin, long or ingrowing toenails, osteoarthritis, diabetes, and poorly fitting shoes. In turn, this can affect your balance. Ask your GP if you have any concerns about your feet. If required, they can refer you to a podiatrist, also known as a chiropodist, for advice and treatment, which can include toenail cutting if you are unable to do this. Wearing supportive, well-fitting footwear, including slippers that will not slip off, are an easy way to also reduce your falls risk. Many falls occur at home because of trips and slips. You can reduce this risk by decluttering your home environment and getting rid of any trip hazards, for example, loose rugs or bathroom mats, loose carpet edges, wires and clutter on the floor. Is there adequate lighting, especially if you have to get up to use the toilet overnight? Do you have enough supports? Do you need a second banister on your stairs? Ask your physiotherapist for a home hazard assessment tool to help you uncover any falls risks at home. Dizziness is very common as we age. It can happen for many different reasons, including low blood pressure, diabetes, heart or lung conditions, and medication side effects. Speak to your GP about any concerns you have about dizziness, as this is also a risk for falling over. There are many reasons to consider making changes to work on your bone health. Some reasons to think about include osteoporosis is not an inevitable part of aging, and you can take action to help maintain your bone health now. Some of the activities and exercises we recommended here can be easily and quickly fitted into your everyday activities. As with osteoporosis, falling over is also not just part of getting older, and it is not inevitable. There is a lot you can do to help yourself. Taking steps to reduce your risk of falling and to improve your bone health can help you to stay independent as you age. And by being careful to avoid falling or situations that increase your risk of fracture is a good idea. And there are many more things you can also do to reduce your risk of falling and fracturing. You might not be at a stage where you are ready to incorporate some of the recommendations made in this talk. It is important to remember, however, that change can mean small things. It's not all or nothing. Thank you for listening and engaging with this Exercise for Healthy Bones talk. I've provided an awful lot of information in a short space of time. You can watch this video again if there's something you've forgotten or want to recap. To help you move forwards with self-managing osteoporosis, I'd like you to take a minute to think about the information you've learned today. Write down 3 new things you have learned from this talk. And then write down 3 things you will change as a result of what you've learned. Please do pause the video to participate in this activity. And finally, try turning the changes you have written down into goals. For example, I will get up at 6:30 a.m. for the next 4 weeks, or I will only eat 1 chocolate bar per week for the next 2 weeks. This can help to support you in making lasting changes so you can hold yourself accountable. Make a note in your calendar or diary to review your progress in a couple of weeks or whenever you have specified in your goals. At that point, you can re-evaluate and consider setting another goal. Now, re-rate your current knowledge and confidence to self-manage your own bone health, as you did at the very start of the talk. Has this changed since the start of the talk? Do you feel you have more knowledge? Do you feel more confident? Or do you have any outstanding questions? And finally, if you are ready to look into increasing your activity or exercise levels, here are some exercise opportunities local to Wandsworth, in addition to online resources including exercise videos. Active Lifestyles provides community exercise classes with costs that vary but not over £5 per class. Exercise on Referral and Douglas Bader Gym need a referral by a healthcare professional, including your GP or physiotherapist. The Royal Osteoporosis Society provides some amazing online resources, including a really good exercise video, so I recommend looking at their website, as does the Chartered Society of Physiotherapy. If you do have any further questions, please do contact the Integrated Falls and Bone Health Service on 0208 812 4079. Thank you for listening and engaging with this Exercise for Healthy Bones talk, and enjoy implementing our recommendations.